Welcome back to the Wise Divine Woman podcast, where we help you go from fed up to faith fueled, helping you to become the wise divine woman that you've been called to be. Today, I have Dr. Jennifer Gularson, and I am so excited to talk about, one of the things that lay upon all women's hearts, libido and sexual health. And it's, again, as much as we don't talk about breast health, we definitely don't talk about sexual health in menopause or post-menopause. So thank you so much for being and answering my offer to come on the show, Jennifer. Welcome.
Absolutely. Thank you, Dana, so much. And I just want to say I'm a physician assistant, so I'm not an MD, physician assistant, but I help patients all the same.
Just as important.
Yes.
So, if not more sometimes. But so what started you on the road? So, yes, being a physician's assistant led you, in many paths, and you've chosen one to help women in this sort of field. What brought you to this point?
So you know that you have your wishes and your dreams, and then you have where God pushes you. So that's where you end up. So I was traditionally trained as a physician assistant. We're usually trained in family medicine. I had a particular heart for cancer therapy, and I did that for about 5 or 6 years. When I got pregnant with my third child, I was like, I have to maybe pick something a little bit easier, if you will. And I was blessed to find an all-women owned practice owned by 3 sisters, which started out as a med spa, which, is a little bit easier. Everybody's healthy coming in and they usually look beautiful when they come out. So during that time, one of the physician that I was working with, she went through menopause and she found herself screaming at someone in the middle of the grocery store and was like, what is wrong with me? She started thankfully investigating and being like, okay, I'm going through menopause. Let me figure out how to fix that. And this was around 2009, 2010. So I've been doing hormone replacement for a good while now. And we were doing it sort of under the radar. A lot of my colleagues were like, this is dangerous. You're going to lose your license. But women were suffering. So we found that replacing hormones was really helpful in a lot of aspects. And then in a broader sense, it sort of brought us to this integrative functional medicine, and I became certified through the Institute for Functional Medicine. So I'm in a practice in Rockville, Maryland, and I treat people and women holistically, looking at their gut, thyroid, adrenals, and then, yes, the sex hormones too. At first, it was, people were finding me word of mouth, underground, and I have to say maybe COVID, one of the good things that came out of that was that the women started talking on podcasts like yours. And we are just talking more. And now more recently with the FDA reversing their decision, tail between their legs. Thankfully, they did that. Now the conversation is even more. So I have a big practice of women from 45 to 65, and even some of the people who are sort of outside the range. That 10 years and 60 isn't like a hard stop. It's a conversation. But I've just been blessed to be able to offer help to these women who are suffering and have gone to every other specialty. And then I have a passion for talking to them about their entire life, their relationships. And then occasionally somebody will open up and they feel comfortable with me talking about their sexual wellness. So that's sort of how I ended up here. It wasn't the path that I thought, but I'm thankful that I'm here.
The hormones, and that's it. Like, the hormones affect so many different aspects of life that women don't know or don't think about.
Yes.
Right. And then now that, it's been whitelisted, it's even approaching women, of course, outside of that scope, but it's like fertility really goes back to understanding more of a functional or integrative approach, because it's the chaos that doesn't allow the body to function optimally. And there's all sorts of things outside of clearing that first before treatment, infertility treatment. And then our life doesn't end at 65 or 70, so it's this longevity of life that, is so important. And now is reteaching women 70 plus or 65 plus that, hormones are really important. Your body's still making them. We've got to make it optimal. And this is how this is how HRT or BHRT works. So it's again, you've done, as soon as you said that, it was like, okay, it's nice to see the rest of the world caught up to you, Jennifer.
Yes. Yes. My girlfriends will be like, oh my gosh, you've been saying this forever. And we just didn't listen to you because the people that we see, our GYNs and internal medicine doctors, have always been, it's so scary. It's so scary.
Yeah. And that's okay. I mean, I always hear that with clients because as a thermographer, and I do their follow-up calls, and there's a lot of unhappy people with their practitioners at the moment. And I'm like, you have to love them for what they know. They're brilliant and amazing, but you're just not allowed to know these things or not allowed to want to go beyond those boxes. So
Yes.
you just appreciate where they are, and then you find the people like yourself, the functional and integrative people who are going to be able to answer those questions correctly. So I just love that. What do you find to be, I mean, it's kind of a twofold sort of idea. It's that, yes, women are starting, we go through this transition during our perimenopause, menopause process. And so women are understanding how their body is changing, but, and then talking about that and what happens and then how we can solve those issues, not solve, but support those issues or solve the issues. But then how are we as women supposed to be approaching our husbands to also start advocating for them or also start dropping hints that maybe they should also get themselves tested and understand themselves? I think it's all great that we as women, the me movement, are taking care of ourselves because that's where our focus goes to. But if you're all riled up, hormonal all set to go, what about the other guy?
Yes.
How do we approach that?
That's such an important thing. And I think I grew up in the 90s. So, I was sexually active in the 90s. I was, in my 20s. I'm 53 now. So we sort of grew up in a time where sex was dangerous. And I talk to my patients about this because a lot of them are my age. Like, we didn't experiment with sex because of HIV. And at least that was my take on things. So talking to a partner about sex is very difficult, I think. And I think the younger generation, when I look at my daughter and my son and with their significant others, they're a little bit more open to talking about their bodies. And they will kill me because I talk about orgasms, I talk about sexual wellness, and that you need to know your body in order to please your partner. So with couples, usually it's funny, I will see a lot of couples here, but individually. So the wives will come in for maybe not sleeping, and then we talk about the libido, and then they get back on track and they're like, well, my husband should probably see you because he's not interested now. So the conversation needs to happen and we need to normalize it. And I think it's just so important, the intimacy. And even if you're not having penetrative sex, the intimacy that happens, and then the distance that can happen if there's a problem on either side. So I usually try to, if I see one of the couples, I ask them, does your partner know you're here? And if we get you started and back and up and running, are they going to be able to come along on this journey? Do you feel comfortable telling them that just because your vagina is a little bit dry, that's not an indication that they're not turned on by you? That can be a mechanical thing. And then let's work together to figure that out. So I do a little bit. So my undergraduate degree is in psychology, which I thought I'm never going to use, but I use it a lot.
You would use it every day. Like you're just, you're pulling those like nugget, those things are like, okay. Okay. So then you know how to approach things. And I'm sure you don't have time to do all of that, but I'm in your clinic and in your practice, you know that you need to have those people, those coaches in play where you can then go, you need to speak to somebody about this. And I think that's what's so brilliant when you set up practices for yourself in clinics and have all those needs filled for each person who's in front of you.
Yes, I have some pelvic floor therapists that I use, and definitely some therapists that I use, sexual health therapists and couples therapists. But sometimes just talking and saying it's okay to talk about this stuff, they do feel a little bit more inclined to discuss it with their partner. So that's always one question. I'm like, do you need somebody to facilitate a conversation, or are you both comfortable with, do you talk about this stuff openly? And sometimes it actually opens a door where my female patient is more than willing and she sort of tugs him along, or vice versa. So I think, yes, bringing in our referral partners is super important, but just allowing them to talk is also super important. And I have the luxury that I get to spend a lot of time with my patients. My first consultation is 90 minutes, and then usually follow ups are either an hour or half an hour. That gives us time to really get to know each other and trust
Mhm.
me as a provider to give them suggestions on how to eliminate the dryness, the pain, and focus on their pleasure, focus on their stress. Because the women who come in here are usually, your kids are a little bit older. Older doesn't mean less problems. It just means harder problems for our kids. But also, they're probably higher up in if they're working, they're higher up in their company. There's a lot of stress there. And then your hormones just fall apart. Right when we need them the most, they just sort of go by the wayside.
It is. It's so tragic sometimes. Yeah, and it's just so frustrating as well. I shouldn't say tragic, but so frustrating at times because we're at our peak. We feel you've created this success, or you're now having the freedom to switch,
Yes.
become creative, and fill your heart's desire with your purpose in life. So, and then you get swept sideways by no sleep and hot flashes and yeah, exhaustion. So I get it. When it comes to libido, so can you just briefly tell me what is
Libido to me is desire for intimacy, whether it is penetrative sex or sexual play and touching and romance and things like that. And you can have two types. One is spontaneous, which we may have experienced in our teenage years when our hormones are all crazy. And then there's responsive. And in a male-female relationship, traditionally, men have more spontaneous because traditionally their testosterone is a little bit higher than ours, and we have a responsive. Most of the women that I see are desiring to have an increase in their spontaneous desire. So a lot of the conversation is, well, how were you before? If you never had spontaneous, I don't know that I can create that for you, but if you did, we can maybe recapture that with some medicines or herbals. And then the responsive desire is a longer conversation about not, scheduling time. And a lot of people don't like to do that, but there's a study out there that says for people who are scheduling time, if they do it month after month, week after week, it tends to then become unscheduled and they do it a little bit more. So responsive libido is find a quiet time for yourself, maybe take a bath, relax, shut out the rest of the world. Maybe there's some erotic reading because that gets you sort of in the mood. There can be some non-sexual massage. There can be, I always tell them, tell your husband that romance starts at 8 o'clock in the morning, like starting those touches throughout the day, having communication, maybe taking something off of your plate. I unloaded the dishwasher today, so that maybe I can be rewarded for tonight. And gosh darn it, if you have a
Yeah.
fight at 8:30 in the morning, don't expect to get lucky at 8:30 at night. That needs to be all resolved. But in
Yes.
all seriousness, it's creating an environment where a woman can step into her femininity if that's her choice, and she can relax because we know we have a million things going on in our life and we are
Mhm.
juggling so much that we just need an opportunity to put that all aside and then have time for like a respected, coveted time for ourselves. And with a great partner, if you explain that to them, I think that goes a long way. But yeah, definitely taking something off our to-do list is an aphrodisiac for us.
It sure can be. Absolutely. Absolutely. And it goes both ways. Like
Yes.
it's again, it's not just for the men, emptying the dishwasher, but it can be for us finding that thing for the man. And I think even understanding love language, which is a really
Yes.
old book as well, but the love language of the person is really vital because, I don't need acts of gifts. I don't even need you to empty the dishwasher. It's other things. And so knowing your partner's love language and what really gets them, what floats their boat is really, I guess, best way to the bedroom.
Yeah, absolutely. I think that, it's an older book, but it's still relevant.
It
I
is.
have couples who realize that you like touch and I want affirmation. but you give a different, and it's also how you give love and how you receive love. So I love cooking dinners and stuff and giving gifts and doing things for people, but they might not receive it. They just like, I just want to spend time with you. That's it. So it helps you how you give, how you receive, and then how your partner and even your friends and siblings and family members, how they give and receive. It definitely goes a long way. And it's an oldie, but it's a goodie. I mean, it's stood
It
the
is.
test of time.
It has, it has. I really like that book. So, really, when you're talking about the changes in libido, what are the specific actions and what hormones are actually occurring that really turn the switch off?
So when you are looking at, we can start with females. When you're looking at females, you do need some estrogen. So it's all sort of combined too. So there's not just always one little thing. So making sure your hormones are balanced, estrogen, of course. And I do use a ton of testosterone. I think it's really important. And my patients understand there's no FDA forms of testosterone that are approved, but we have a ton of studies showing that it's safe, effective, and it's very, very helpful. I can't say that every person it's a home run, hit it out of the ballpark, but it definitely helps. And then also, you have a little bit of weight gain sometimes with menopause, and women don't feel good about their bodies. So helping them with their diet, with their sleep, lowering stress, and then the interpersonal relationships and going through that. Those are all
Right.
super helpful. I use a lot of herbals like adaptogens to decrease cortisol, especially with my stressed out females. It helps them sleep, but then it also decreases cortisol so that then your body can continue to make the hormones that they need. And then there's some approved in perimenopause and now in menopause, some medications that boost libido. But I usually use those after I've tightened up everything else. Tell patients all the time, and men are harder than women, but the hormones are just one piece. If you're not doing everything else in your life that are supporting with the sleep and the relationships and your stress and your eating and your exercising,
Mhm.
then that is going to be, it's not going to be a knock it out of the park kind of thing.
Yeah. I that's how I sort of approach it when as a medical thermographer and a thermography advisor, that question of hormone replacement comes up all the time. And I have to remind them that this chaos that we're looking at here, or this like, there's a lot of stuff to take care of, won't work unless this is cleared and
Yes.
balanced and you have a bit of a grasp of it to make the other hormones work. Where does progesterone play a role in our libido?
So, yes, but in a bigger picture, I think it decreases anxiety, and then it helps the sleep and it balances out that estrogen. And I can't go without saying that vaginal estrogen is a really big part of my practice and explaining why, even if you're able to have intercourse, after about 35, we should just probably be giving everybody estrogen to use vaginally twice a week to prevent things.
Right.
Explaining how the vagina lengthens during or needs to lengthen during intercourse and how we are more of a crock pot creature versus a microwave creature. Men can do things very quickly. Women need to be simmered, slow simmered, and things need to have blood flow, and estrogen helps that. I use a lot of DHEA also vaginally to help with, because that will hit both the testosterone and the estrogen receptors.
Oh,
So I'll use
interesting.
those together in addition to some of the over the counter things like Bonafide and the hyaluronic acids in there. So I've put them on sort of like a vaginal routine, if you will, to make sure that there's no pain. It's interesting how many women are stopping having sex because of the pain, and they just think that this is normal. No one's really talked about it. I mean, in our space, I mean, we see Dana and I, we see everybody talking about this. So it floors me when people are like, "What do you mean hormones aren't?" I'm like, "Haven't you seen anything?" It's all over my feed, and I just assume everybody.
Yeah.
But it's just such a good feeling to have here is a very cheap alternative to some of the more expensive procedures, the laser procedures or the PRP. I think in conjunction they all work well together.
Right, when you're talking about the vaginal care, I'm like, women spend thousands of dollars on facial stuff, but if they knew they need to like, and I never really like hydrochloric acid or DHEA suppository. I never heard of that. Makes perfect sense to me. But so are you finding, as a segue, are you finding that women are now having much more vaginal dryness or changes vaginally younger now? As the perimenopause, of course, we see is starting younger now. And is that because of just the amount of environmental toxins that are out there, or is there a genetic thing that's going on?
Yeah, I think that from my experience, when women come in on oral birth control pills, you would think, because it's not intuitive, that they should be fine there, but there is a lot of vaginal dryness. Also with IUDs. I love IUDs. I think they're great and to prevent pregnancy. And then a lot of people use them through perimenopause to either regulate or decrease symptoms, but that can cause vaginal dryness also. And I think on a personal note, when I was breastfeeding my children, I was like the Sahara Desert, and I really didn't understand that. But your hormones drop dramatically right after. So using some progesterone postpartum, especially if they're having pain and they're nursing, that's great. But I've also started using it with women with IUDs because they have that vaginal dryness also. So younger, maybe, but sometimes I think it's a trifecta of they're super exhausted. Their kids are young. They're probably not having a lot of sex anyway. So they don't really realize. And when they do, it's uncomfortable and I'd just rather not do it. But teaching them that we need to maintain that as well. But I think also it was probably this ubiquitous, but now we're talking about it.
Yeah, exactly. No one would ever say a thing, right? And it was, you just use lubricants, it's fine, and all those types of things. So go ahead.
I was going to say the lubricants are another one where I say use it all the time, even if you don't feel like you need them, because you do get little micro tears that maybe the next day occur as little rash or itchy, and then they think, oh, I have a urinary tract infection, and then they end up over treating that. I think that we do a lot of over treatment of infections that aren't really there because of us not protecting the skin. So using the estrogen as a protection, as a preventative measure is really important. Then using the right lubrication is also really important. And then I will say I was listened to a podcast and watched this or heard about a study about vibration. So using vibrators externally, you don't have to use it internally, how that brings blood flow. It's all about blood flow, right? Blood
Yes,
flow to the area so that your tissues can maintain its elasticity, so it stretches. And even using a vibrator, I think it was 5 or 10 minutes, 3 days a week, decreased the lichen sclerosis in some patients. It actually resolved it because the inflammation was down, because the blood flow was there and all the healthy tissue is there, and helping prevent the dryness. I found that completely awesome. And then use it in certain patient situations to talk to patients and say, are you open to talking about sex? And I just have this suggestion that you can use this external vibration to sort of prepare you for sex, but then it's also a treatment modality to help with the dryness, in
I
addition to
wonder.
using all the other stuff.
In addition, yeah, no, I think that's amazing. And then what came to mind for me was so when the lymphatic system drains into the inguinal groin, you have this little. If no one addresses it and everyone sits too much now, if we're not
Yeah.
activating and moving and draining, then you have this cesspool of things that are happening and sitting. So we have to drain that out. And then, as much as my basic knowledge of or what I think about things is that we see erectile dysfunction happen when you're down that slope of cardiovascular health. Does the lack of blood circulation or viscosity through the vaginal region also indicate or give that little window to you know
Yeah.
uh, heart health, right?
Yeah. That's a good sort of connecting the dots.
Mhm.
For men, it can be a great indicator of cardiovascular disease, and sometimes will be the impetus for patients seeking treatment, but then also starts the conversation about testosterone replacement. And I think, which came first, the chicken or the egg, the FDA taking away the black box warning on testosterone. So that's always been, it causes cardiovascular disease, prostate cancer. And for years, we've known that not to be true. But thanks to the Traverse study, it was actually to pull that off. And I don't know if that opened the floodgate for the FDA to be like, oh, we pulled that off of testosterone. Maybe we can then say we made a mistake with estrogen. I hope
Well,
so.
I think it's the undeniable or part of the undeniable research that's going into dementia and Alzheimer's
Yes.
and for women and heart disease for women when there's just so much that points towards hormones and estrogen.
Yes.
Right? Yeah,
Yes.
I mean, amongst many other things, but it's this increase of that, and we know that fat is necessary for the body, necessary for the brain, so that's been debunked. And then now it's the estrogen importance when it comes to heart health, brain health, bone health that it's undeniable. They cannot refute it, thus removing the black label. And then now the testosterone component for men is great, but now we have to really work, or you have to really work on that testosterone component for women worldwide, right? It's just this because it is very difficult and it is necessary. Bones, muscle loss, there's and energy production. So it's just, it's so, so important.
I have a lot of women coming to me already on hormone replacement, estrogen and progesterone, and doing well on that, but they feel like they just have that little piece missing. And sometimes it's joint pain. Estrogen's great for that, but sometimes testosterone can help with that, or not being able to, now we're pushing women to get off the crazy cortisol elevating, CrossFit, doing all the crazy cardio. We're doing more like lifting is getting gains in the weight room. So testosterone helps to build that muscle, increases insulin sensitivity, decreases weight, helps with your mood, your brain, and your bones. So those are all the things I sell testosterone on because they equate, and especially men, they equate it just with sexual libido. And I'm like, there's so many other things that it does. Sometimes I can get men on the testosterone board if they don't want to admit the libido stuff with sleep, muscle, weight loss, brain, competitiveness, motivation, then they're more willing to have the conversation about maybe some replacement, despite having that trying to get rid of that dogma. It was
Hmm.
so
Hmm.
interesting. I had a female patient want to start hormone replacement very slowly because she wanted to be intimate with her husband. She was very frustrated because she had so much vaginal pain. So we started this, and then we wanted to add in a little bit of testosterone for her. And her I forget what type of physician it was, but I think it was her hematologist because she had a protein S deficiency. We were doing all the testing. We're doing that very slowly. He says to her, yes, I think you can do the testosterone. It's safe for you, but be careful that it doesn't get on your husband because you can give him prostate cancer. And she came in, she's like, I just want to make sure that this isn't true. And I said, actually, that was the dogma, but the amount that you're on is so small, he'll never notice it. But yes, take that out of. I was like, I don't need you to have one more thing to worry about.
Right.
So it's interesting. I give my advice. I'm not here to talk anybody into anything. I'm
No,
very, very passionate about it. I give them the information, and it's frustrating when they come back saying like, "I was told you're going to give me a heart attack, a stroke, or I'm going to die because of the advice that you gave me." So then it's re-educating, and then it's up to you. It's your prerogative. I
right.
wholeheartedly, and I tell them what I'm on and what I'm doing and my experience. And that's all I can. And then I can show them the studies, and that's all we need. All we can do.
It is all we can do, right? Just offer the information, educate, and allow them to make those really wonderful choices. So, with all this peptide rage,
Hmm.
and of course, everyone has like complete access to GLP-1s. We're not seeing any side effects to libido or vaginal health, or are you really, I mean, I would hope you're really promoting that balance hormone to get that GLP-1 to work better. Better yet, like, are you then moving into the different peptides that are going to help with libido and brain health and
Yeah, it's people come in with this peptide and they don't really know what peptides are. So it's fun to do some education. And then, people are like, oh, I want to do it for longevity. I'm like, this could be a daily thing of 2 or 3 different peptides. Like if you want to go down that route, I can help you, but just know it's expensive. And
Yeah.
then also there's like needle fatigue. I like doing it every night. So I do. So peptides is a huge, huge subject, but specifically the weight loss ones, I am more inclined to start super low, like do a micro dosing, especially if they're hormonally optimized. But they have to be doing everything else correctly. It's
Yeah.
not just a license to eat, and I think to eat what you want. The problem happens when we escalate, and this is just my opinion. When we escalate too fast, I feel like we put a paradigm and a way to treat diabetics, and they just lifted that up and then put this, and this is how we should be doing it for weight loss. I don't necessarily agree with it.
Mhm.
Late too quickly, too much, that if we're just patient and people do it slowly over time. I have patients that lose 15 to 20 pounds over 6 months, 9 months. I think that's more healthy, and you're not blowing out all your receptors, and you're not escalating the dose and the side effects, because most of the
Mhm.
side effects that I see are the hair loss, the nausea, the GI symptoms. All of those increase when you stop eating altogether, and then also when you're escalating those doses too much, and then so I have a very conservative approach when it comes to the weight loss medications, but I'm also
Right.
using them in cases of inflammation. So a lot of people who maybe no don't even need to lose the weight, but I put them at a quarter of a starting dose to help with that inflammation. I have used PT1. I've had a little bit of nausea. It works for men and women. And I feel like it's a little inconvenient because you have to give yourself a shot about an hour before. But for some people, it can really, really work. And then Addie, I use that medication, the oral medication. It started out as a I guess it's not really a peptide, but it started out as an antidepressant that didn't work really well. But everybody was like, oh, my libido increased. About 65% of patients, their libido increased.
Yep.
And then I use a little bit of NAD. I use BP 57. I use CJC. I use ipamorelin. I use a lot of samorelin for men because I do think it helps them sleep, and it may help with their testosterone if we're on
Mhm.
testosterone replacement. So, do I think that peptides are having a side effect on sexual well being? I know that Rachel Rubin is doing a study on that. I know that in it can alter your microbiome, which will alter your neurotransmitters
Mhm.
production. When you stop eating altogether, your microbiome, or if you're not eating properly, your microbiome suffers, and therefore may lead to some like discomfort and sexual dysfunction. But libido for GLP-1s, I'm going to let Rachel figure that one out. I know she's doing
Yeah.
a
No,
look into
it's interesting,
that.
like, let's say you have your clients and you're reestablishing their foundation of health, and then you're supporting it with nutrients, supplementation, and hormones when needed to bring them up to their optimal,
Yes.
right? And then they wanna start playing around with these things. Well, and that's where the peptides to me make sense.
Yes.
After you created and rebuilt your foundation, you feel solid about things, and then there's some voids that are not there, that's where that makes sense to me. But people are just jumping in, having
Relying
fun.
on it. Yes.
Yeah, and I'm like, that's just gonna lead to a lot of problems because you haven't rebuilt the flora. You don't know what stress management or what cortisol is happening in the body. You don't know exactly where your hormones are at because then you're just throwing paint at a wall doing nothing. So
Yeah.
it's really important where you go back to the functional medicine, integrative medicine, understanding your body as a whole, and then you get to have the play with the fun stuff, right?
Yes,
Makes
absolutely.
way more sense. And I think that's it. Like, so here in Canada, I think there's a news. My girlfriend had said they're going to switch, and the GLPs are going to be available to far more people. So much wrong with that. But it's, again, we know the gut, we know those things. And I'm like, okay, this is just going to create a terrible storm of more side effects down the aging line, right? For longevity, where there's malnutrition,
Yes.
there lack of
Muscle
fat absorption.
wasting.
Yeah, that's just like, okay, I get it. we all want to be skinny and we all think we're going to be healthy, but I just see that it's just going to be a disaster down the road.
Yes, it's something that my patients, they get frustrated with me because I feel like they do want to escalate a little bit, sometimes a little bit more quickly than and I'm like, well, are you doing everything else I asked you to do? And that's where our health coaches come in to like make sure that they're getting prodded along. But
Yeah.
I think they also see a lot of the influencers and the biohackers who actually are fundamentally amazing at all the, the pivotal foundational things, their sleep, their eating or whatever. They are already meticulously fixed all that. Now they've added all this other stuff, but you're seeing them in their 5.0 and you haven't even
Yeah.
started 1.0.
Yeah, I noticed that, like, with the 2 different girls that I follow teaching and talking about the peptides. Again, they've done the work,
Yes.
right? They have done the testing and they've done the follow-up testing and they've really run the ring on that. Mind you, I don't think they're quite through menopause yet, but that'll take them sideways. No, I'm just kidding. I think they're both
You just wait.
perimenopause.
I
I
always
don't
say,
know.
you just wait. You just wait.
I think I was fine like Perry, although I question now that I'm learning these things. I'm like, how much of postpartum did I have really? Like, it's just because it wasn't even back, when I had my kids in 97, 98, 99. It's like, where was I after that? And now, you perimenopause just, I think, just blew through, although I don't know. Now, postmenopause, it's these now that I'm talking about it, I see the signs, right?
Yes.
But anyways, it's the work and it's the follow-ups and it's really understanding and it's getting for people who are listening, it's finding people like Jennifer so that you can really build or functional medicine or, those types of things. It's really filling that foundation, building it, making sure you're good because it's a longevity game. It's not a quick fix. And then understanding now, and I think with the FDA lifting that, it is this, even though you've been preaching it for 20 years, it's like these are really important things and it's necessary. And don't be afraid. And if your doctors are telling you different, it's just because they're not caught up on the research. That's all. Then you
Yeah.
just find
We
somebody.
didn't learn
So
any of that. I didn't learn this in PA school, and I do some teaching at PA schools, and they're not there yet. It's going to take us like
no,
10 years to change
it
curricula.
will. Yeah. And the same with doctors. They don't have time, nor are they
No.
allowed to fill their heart's desires on new things just because of the way the system is set, I think. And they'll get there. But that's why in the States, you have all of these niche doctors, right? You have all
Yeah.
these specialists, so to say. And then that's just the way it's set up. And you have to be a self advocate. And I think the brilliance with people like yourself and the clinics that you have and the podcasts that you reach, it's teaching this self advocacy.
Yes, that's something I'm toying with now because I realize that even if one of your listeners says, well, how can I work with her? I don't live in Maryland, Virginia, DC area. There is going to be an online component of my practice where I can interpret your labs. I can't prescribe anything, but I can give you advice on how to approach
Mhm.
somebody or work with you and try and find someone in your area that
Yeah.
will prescribe.
Yeah. And that's the uniqueness with that, right? Like you have online companies, but it's hard to trust them maybe from a professional point of view. And it is creating that network, that collective of people that can be follow the same guidelines or functional. And maybe that's something down the road for you to create in that network, trust network that people can refer to, state to states because it's important, right?
Yes. Yes.
Awesome. Awesome. So am I missing is there any missing link that people don't know about when it comes to sexual health, libido health that I haven't asked?
I mean, I think I think communication is the hardest. It's the most important and probably the least talked about in a doctor's office or in a healthcare provider's office. So communicate, communicate, communicate. Talk with your girlfriends. They can be a wealth of information. And yeah, talking with your professionals that are willing to talk. So I think the communication is a big, big thing. And that's the biggest barrier I've seen to just even figuring out what the problem is.
Yeah.
I can give you a bunch of solutions, but if the problem is you're angry with your partner, then we need to address that. Or you don't feel good in your body. Okay, so let's try to get you some weight loss. Have you lift weights, if you're not feeling yourself about your body. Normalizing the conversation.
Right.
Because we're
Right.
good at talking about our periods. We are great about talking about our child. Everybody has their childbirth stories of every single kid and what did they feel like and what happened and what did the doctor say and what did pushed for 4 hours. I did all this stuff. And then we stop. And I think we just need to, because our moms didn't talk about it either.
No. No.
So I try to empower other women to speak about to other women, especially if they've had really good gains in their lives and have been transformed. Talk to your friends, tell them your story, because then you'll find and then you will hear, oh my gosh, I thought it was just me. To have
Hmm.
that, it just breaks my heart. Yeah, you're not alone.
Yeah, I love that. Before we finish, I just want to ask, what is a word of wisdom that you hold true to?
So I've heard you ask other guests this, so I was prepared. I've been, I was walking my dog this morning. I was thinking about it, and this word
Yeah.
just keeps coming back is grace. Giving yourself grace, giving your body grace, giving your provider grace, giving your partner grace. Just being nice to yourself, knowing sometimes you're going to be overwhelmed, and just being patient with yourself. Don't need to fix everything right away. There are steps, and you didn't get this way. I'm 53. It took me 53 years to get here. So there's always little tweaks, but doing it with grace and giving yourself to time out, vacation, sleep in till 9 o'clock. Give
Yeah.
yourself a little grace.
I love that, Jennifer. Thank you so much for being part of the show. We're going to put all your information, where to find you in Maryland, and all the goods that you can offer. And I am just so truly blessed to have you on the show.
Thank
Thank
you.
you
Thank
so
you
much.
for your work that you do as well.
Yeah, having fun doing it. So thank you so much. Well, that was incredible. Thank you so much for being part of the Wise Divine Women podcast, where we're helping you go from fed up to faith fueled. Thank you for joining the show. Be sure to like, share, and definitely share this episode with all your besties. Bye for now.